And I am live. So thanks for joining today. I'm flying solo. Gandhi has given me the keys to the car, and I'll be providing EGP Learning's updates today. So we normally do a soft start, don't we, as people join. Don't be too disappointed. I've got a great episode planned, and actually Gandhi will be joining on video. So we'll just see if a few more people join. Obviously, opportunity to be a bit more interactive. So do let me know if you have anything to add or contribute to today's stories, and I will bring your comments on screen and respond. You might have other questions for me. I'll try and respond to those as well. So I think we will get started. So here's the bit that comes on the recording. So we cut that soft start. So, yep. So welcome. It's another episode of EGP Learning. Andy is flying solo today, been given the keys to the car by Gandhi, but I'll be bringing you all the updates and big stories that have happened in general practice over the last 1 to 2 weeks. I mean, some big things have happened. We've got a new government and all sorts of other things have been happening as well. So let's take enhance your primary care and learning. Okay, so welcome. I mean, those of you who might be missing Gandhi will be pleased to know that Gandhi is joining in a way of sorts. So Gandhi's provided a video. He's out on manoeuvres in Cambridge at the moment and can't join us this evening, but he's provided a video with some comment on some of the stories of the last week. So we'll be playing that, and I'll be reacting and trying to have a conversation with the video. Please comment at home. Opportunity to be a bit more interactive with me today, so that will be appreciated, and I'll bring comments on screen. So what stories are we looking at today? Well, we've got a local story about a practice closure in Nottingham. Sadly, that follows a trend, of practice closing nationally. We'll be having a look at that. We'll be thinking about the things that the new Secretary of State for Health, Wes Streeting, might be able to do to stem the tide of practice closures. There have been a few suggestions from the BMA and others in the news, and we'll be looking at those. In particular, moving to limited liability partnership structure, and maybe moving to a waiting list system for general practice. It's that time of the year when the GP survey comes out, so we will be looking at some of the headline GP survey results and signposting to some resources you can use to make best use of that resource. Speaking of surveys, the local LMC have also done a survey, so we'll be having a look at some of the results from Nottinghamshire LMC Survey about the state of general practice in Nottingham. Is it the same as your area? Is it different? Probably quite similar. Similar challenges up and down the country. And also, we will be looking at the return of a familiar name, Lord Darzi. Do people remember Darzi centres? So we'll be having a look because he's made a return to government and is working on a report, and we'll be looking at that. So let's get started, and let's bring sort of virtual Gandhi in, and let's see what Gandhi's found in the news this week.
Hey GP learners, so I'm live off location, not really Nottingham, but I'm going to give you a Nottingham related story. So unfortunately in Nottingham, another practice has handed back its contract. This is a forest practice based in the Hyson Green area, one of 3 practices in the local area, and as a result of that, the patients are actually going to be dispersed because there are approximately 4,000 patients. This is going to have an impact on the local area, absolutely, and it is a clearly concerning thing, given another practice handed back their contract just a few months ago. It is a slightly different reason. I'm not doing any drawbacks or anything like that, but unfortunately follows a trend that we are seeing, not just locally, but nationally as well. Hearing about practices in Cambridge and similar things that are having to be in similar situations, or due to financial constraints. I guess the key story to have a look at, which Andy's hopefully going to show you as well, is the survey from the NOTS LMC that they've been doing for the past few months, looking at hearing from local practices about their intentions and what the issues are they're facing, both financially and in terms of contractual aspects and so on. Particularly in 1 in 12 practices are going to be potentially handing back their contract in the next 3 or 4 years. Can't remember exact dates and stuff. But this is clearly worrying stuff that we're seeing. Also seeing from that survey, increasing number of practices having to reduce the amount they spend on locums, which we are definitely hearing about across the board in terms of the impact it's having in terms of the employability for GPs, and also various other aspects that those practices are having to cut back because they just don't have the resources to be able to provide the care that we want to and stuff.
So let's stop Gandhi there. Let's bring me back. And let's have a look at some of those stories he's highlighted and some of the other ones that that are sort of connected to the issues there. So this is the Evening Post. It's our local newspaper and news website here in Nottingham. And here's a picture of the practice. So I think Gandhi and I felt that we ought to acknowledge this practice because it is a good local practice, 4,000 patients. We've worked with one of the GPs who was one of the clinical directors of one of the local primary care networks. I worked with with the practice manager at the local federation. So really good, effective general practice. I think the issues leading to closure have been multifactorial with succession planning issues and the general financial squeeze and situation of that practice operating in a really sort of challenging area, actually, and doing a really, really good job. One of the most deprived and diverse parts of Nottingham, Hyson Green. So I think we really just wanted to just acknowledge that loss, really, and comes on the back of Windmill Practice, another really well-regarded local practice, handing back its contract a few months ago as well. Patients at the Forest Practice needn't worry if you're watching. There is going to be a list dispersal. The ICB will be allocating another local GP surgery to you. Obviously, you can choose to register with any local surgery if you aren't happy with where you're allocated to, but they will be finding a home for you and making arrangements for that practice to be properly funded to look after you. So rest assured, but a sad loss. Just thinking about some of the things that Wes Streeting, he will have a really busy in tray, and think about some of the things that he might be able to do to help. Let's just bring up some stories here for you. So one of the things is that the BMA is pushing for GP partners to be able to enter limited liability partnerships and hold contracts in that form. Now that might sound not great. Hope for just bringing in some comments. Jason Melody, friend of the podcast, welcome, and hope you're enjoying this solo version. JC, do put up more comments if you're able to. We'll bring things on screen. Sound not great. John, is that me, or is that was that Gandhi's video? Hopefully it's not me, but I can maybe improve things if it is. So just looking at this story, so BMA pushing for limited liability partnerships. Now, some people might remember, and I remember, there was a review in 2008 into general practice sustainability led by Dr. Nigel Watson. I remember it quite well. He was a LMC chief executive from Wessex, I think, and he actually came to my practice because he came to practice up and down the country to write his review. And back in 2018, this was one of his main suggestions within his report to improve practice viability. Now, people might think, why does this matter? And the reality is, and Gandhi and I do talk about this quite often on the podcast, GPs currently hold their contract under sort of classic partnerships. I think it's governed by John's just confirmed it was Gandhi. I'm fine, so that's good to know. Thanks, John. So GP practices operate as traditional partnerships. I think it's something like the 1884 partnership law or something. It really is a sort of truly Victorian way of doing business. And what that means is that the GP partners who run a practice are together responsible personally for financial and legal liabilities of that practice and how it operates. So in worst case scenario, if the practice is left with a big bill, say they've signed a long lease on a building and then the practice becomes non-viable and they can't operate, in theory, the partners could be liable for paying huge sums of money to be released from that lease, for example, or other obligations that they might have. Partners might have to sell their cars, might have to sell their houses, declare bankruptcy in absolute worst case scenarios in order to do that. And this is cited by many people as one of the reasons why new GPs aren't always younger, but why those GPs are more reluctant to enter partnerships. I think this was maybe a good way of doing business in the 1940s, potentially, where the liabilities were quite small. You have GPs just pooling together to have one or two receptionists, maybe have a practice nurse a little bit further down the development of general practice, and those liabilities weren't huge. But now you've got big practices, big premises, big leases, human resource liabilities, for staff and redundancy are much bigger now. So many people argue that this is not a good enough and modern way of doing business. And that's a point that I made to Nigel Watson when he came to our practice, and I'm sure many other people did, and it made it into that report. So the BMA are now pushing for a form, I think, limited liability partnership. So I think that's how accountancy firms and sort of law firms are arranged, and that means that the liability, they're able to distribute sort of profits, in the way that partnerships do in order to pay their partners, but the liabilities stop with the partnership and don't transfer personally to members of the partners. I'm not a lawyer, I'm not an expert, but that's my understanding, and that sounds a much more modern way of doing business. Many people say that this would make GP partnership much more attractive again, and would increase the viability of that as a way of doing business. And I was getting behind this back in 2018, and I'll still get behind it in 2024. Wondering what people out there think about limited liability partnerships, and whether this is a better way to do business. Would be really, really interested to hear. It's something that the BMA are now pushing with the new government. I think the new government have said that they're determined to fix the problems in general practice, but they've not specifically commented, I don't think, yet on limited liability partnerships. So that's one thing that Wes Streeting might do to rejuvenate the general practice sector. I mean, people do differ in their attitudes to partnerships, but personally, that's something that I would like to see, and would make that option of doing business much stronger again. Let's look at something else that the BMA are suggesting. So GP partners should be offered. This was a link, actually. So this is a picture of Nigel Watson. So I saw him back then. This is the story back from 2018, and we'll link to this in the show notes. So BMA are also suggesting that practices should and could move to a waiting list structure. What does this mean? So the BMA have published new guidance, and in it they've said, we advise general practice to move to a waiting list system for appointments, as demand currently greatly outstrips capacity. They cite that there has been pressure on GP practice to provide near immediate access and management of all patient problems, regardless of actual clinical urgency. This is impossible to maintain and not required by the GMS contract. They remind practices that they are obliged by their GMS contract to provide for the reasonable needs of their patients and for the assessment of urgent problems arising in their patients in their practice area, but that emergency or urgent problems can be directed to the emergency departments. And they suggest that patients can wait, that can wait, be placed on a waiting list if safe capacity for appointments is exceeded for that day. So interesting suggestion. Interested to know what people out there think. I know that we have patients and some patients out there. We have probably some GPs out there as well, what they think to this suggestion. I know that when Gandhi and I covered the modern general practice changes that were imposed as part of the GMS PMS contract imposition last April, many interpreted that as providing a framework for waiting lists of sorts, because we were required to provide a response to all people making inquiries at the practice or requesting appointments on that day, but that response might be to advise them that they will be given an appointment at a date in the future. Again, I don't manage your contract. I'm not your ICB. So before you make changes to your appointment system, you may want to consider the position of your local ICB. But I know that some practices, for example, in response to electronic consultations, making a quick assessment of what's going on, might send a link to their phone to book an appointment using some of the functionality within various providers of IT services to practices, a link that patient can then use to book an appointment in the future. And measures such as that sort of introduce a waiting list of sorts, in terms of a response is not provided on that day, and patients sit with that link until they book an appointment in the future. So really interested to know what people think. Just looking at some comments coming through. So it looks like Dr. Gandalf, he is out there. He is watching. Echo, echo, echo. Sorry, all. It's probably my implementation on my computer. I did share the audio from my screen, but maybe I didn't do that effectively. So sorry about that. Just taking some other comments coming through. So John Henderson saying theoretically they could put your contract out to tender. So okay, I guess you're talking about if they're making big changes to the way in which partnerships hold contracts, and also if there's anything that sort of triggers a change in the hold of that contract, as I understand, then that might trigger a tender event. So that is something. I mean, one would hope that the BMA would negotiate on the changes in such a way that that would happen, and that the government would be responsive to that. But yeah, in theory, that's a risk. I know that in some areas, and it was mentioned in the article, GPs have been able to hold their contracts in limited liability company structures and use that as a way of limiting the liabilities. But I believe that the transfer from the partnership model to a limited liability company model needs the permission of the ICB, and it is a change of provider, so that is probably not available in all areas and might trigger a tender event. Let's see what else John has had to say. The conflicts with all the current access targets. So you might be talking about the waiting list appointment. Yeah, and I think a lot of the things that the BMA are suggesting as our union and representing general practice and the welfare of general practice, and supporting, and being supportive of patients is often not in line with what the government has been recommending. So I think you're absolutely right. And then John has also said, if you're moving to a PLC, that is, okay, so that's providing a bit of clarity in terms of, you're saying theoretically they could put your contract out to tender if you're moving to a PLC. And I think that's absolutely right. And we did discuss that. And also, we've got some input from JC Melody. I like the appointment booking system to a suitable date. This 8 a.m. same day system doesn't always work for people. So I think JC might be an example of a patient who watches and follows us here. So it's interesting to get patient perspective. And I think that's a vote in favor of being able to book appointments in the future using links and not necessarily needing to be given a specific appointment the first time that the GP is contacted. So that's really interesting. So let's get back to some of these stories now. I think we've really explored that one really, really well. Gandhi in the video was talking about the local LMC survey, and this did make it all the way from Nottinghamshire LMC and into Pulse, linked together in this article, which talks about the closure of that local forest practice in Hyson Green in Nottingham, but also providing the results of the local LMC survey of practices. So quite transparently, they say 72 practices responded to the survey, and this was 55% of all practices, so all those invited, so a 55% response rate. And some really interesting headlines. I think Gandhi gave some of these. Just in terms of the vulnerability of practices, so half of practices have 3 partners or less, so that might place them in a vulnerable position, particularly if some of the partners are older, or for other reasons closer to retirement, not always age. 9 of the practices are single-handed, so they can be considered, particularly vulnerable to single-person risk, and often single-handed partnerships are perhaps older partners, given that that's a more traditional or perhaps I want to say old-fashioned. That's not the right thing to say, is it? But many of those practices have operated in that way for a long time, so they might be considered particularly vulnerable. 16% of practices, so 12 of the practices, are considering handing back their contract within 3 years. So that's that should be really, really worrying. Hopefully the government are able to make some changes, but that is really, really worrying and sad for the local GP community. This is interesting. So this survey cuts across a lot of the stories that we've been covering on eGP Learning over the past few months. So 57 practices, so that's 79%, so nearly 80% of practices have reduced or stopped entirely their use of locum GPs due to insufficient funding. So we've been covering this story that has been championed really by, I think, Katie Bramwell-Stainer, in terms of reframing the debate around general practice staffing to one of workforce crisis. It used to be that it was difficult to find GPs to pay to do sessions at your practice. Now it's difficult to find the money to pay what is potentially an abundance of GPs who might want to come and work at your practice. There are GPs out there, but because core funding has not been increased meaningfully, so the amount of money that is available to pay GPs has not been increased in real terms for many years, yet new GPs have been trained and are now on the market, the jobs market, looking for work. There just isn't the money there to pay them, and that's a really sort of quite nonsensical state of affairs. But that's a bad figure, isn't it? Nearly 80% have reduced or stopped using locums entirely. 23% of respondents said they may need to close within 5 years. And the reasons given for this: so practice sustainability most at risk due to lack of national contract funding, rising costs of staff. Obviously, whilst core funding has been going up at roughly 2 to 2.4% per year for the last 5 years, if we look at last year, minimum wage, many of our administrative staff will be on minimum wage, and that went up, I think, by roughly 10% last year. The Doctors and Dentists Review Board awarded a 6% increase for salaried GPs last year as well. The maths just doesn't add up. So rising staff costs really does threaten financial viability. And finally, the third, I'm sure there's a 4, 5, and 6 as well, but the third main reason was workload shift from other providers, such as hospitals and community providers. And there's a story behind each of these points, really, and we have covered these in the past. So any more comments? So let's bring a comment up from JC Melody again. Future appointment booking is much more suitable for general medical ailments and such like. Not everything is a same-day emergency. It may even loosen things up. So, so good comments, JC, and it's really useful to get feedback from patients here. So thank you very much for those comments. So speaking of surveys, let's make sure I'm navigating around here. So it's that time of year again. The GP survey is published. So it's published every July, and Gandhi and I normally do an episode on this, and we may do one in the next few weeks, but just covering the survey here to make sure people are aware in case they missed the email that the survey results are out. GPs are required to look at this with their staff, or certainly strongly advised to look at this with their staff once a year and reflect on it. Also, we often find at this time of year, we see I always describe them in the past as lazy journalism articles that basically take the data and say, these are the best GP surgeries in the area, the top 10, and these are the bottom 10. And it's really demoralizing if you ever find yourself in that bottom 10% and get called for comment by local press. I often see these stories in the Daily Mail as well. We'll have a quick look at the headlines results in a minute, but you can go to gp-patient.co.uk to have a look at your practice's results, and there are some tools to compare with other practices. We have lost the thumbnail. There we go. This is our last year's video about making sense of the GP survey results. Again, links in the show notes up a few minutes after we've finished. And we talk about how to use the online tools to explore the survey results and compare with local practices, national averages, and try and do something useful with the survey results in practice. Talk about how to use them to drive change, engage with PPG, and so forth. So please do check that out. So what are the headline results? So the headline results are, so in 2024, so 3/4, so about 74% of patients found their overall experience of their GP practice good. This figure caused quite a lot of headlines for the past 2 years because this was a figure that was falling. Now, an interesting thing about the results this year is they've actually removed the ability on the website to compare with previous year's results. They say there's been a redesign, and in fact, many or most of the questions are now asked in slightly different ways, but they've removed the ability to compare with previous results. That being said, Pulse have done some digging and applied some common sense, and actually, so in 2022, the number of patients saying they had a good overall experience of their GP practice, so very similar wording, was 72.4%. In 2023, so last year, it was 71.3, and we were hitting sort of all-time lows ever in the history of this survey. So this year, to see a very similar question receiving 74% represents a move in the right direction. So we might take some solace in that. The main sort of talk this year in Pulse is about variation. So they highlight that the responses to the survey vary a lot between ICSs. So people reporting an overall good experience of their GP surgery ranges from 57% to 75%. So there's a big difference between different ICS areas. And they also highlight that there's quite a big difference in the survey responses across ethnic groups as well. With an overall average satisfaction of, say, 67%, but much lower, say, for a Bangladeshi population at 54%. So that's quite interesting, and perhaps something to take into account if you are covering a really diverse area. Just that nationally, actually, different populations might respond differently, and also to think about why that is and what people can do to address that. So let's move on. So I think I didn't get quite to the end of Gandhi's video, so apologies. I've not done anything to correct the sound, so the sound will probably still be a little bit ropey here, but let's just finish Gandhi's video.
The question is, how can we improve this? I think there's some work going on through the BMA. Absolutely. We're hearing about absolute stuff around safe working as well that comes into play as well to make sure it's safe for patients as well as for clinicians at the same time. But the key thing will come out of whatever West Streeting and the new government has in terms of what this means for general practice moving forward. Back to Andy. Hey, GP learners.
Oh.
I'm live.
Well, thank you, Gandhi. And so back to me. Let's go back to my news stories. So Gandhi mentioned two things there. So the BMA. So we'll talk about the BMA in a second, and we'll end with that. But he talked about Wes Streeting, the new Secretary of State for Health. Now, we always have a look at and profile new health secretaries. So we'll be doing that when Gandhi gets back from Cambridge. But and there's an interesting lineup actually. So we've got Stephen Kinnock. So he's been around for a long time in Labour actually. The son of Neil Kinnock, who was leader of the Labour Party some years ago. I think back in the 80s to maybe 90s, a little bit before I was terribly interested in politics. He's coming as the Minister for General Practice. So we discovered that existed a few episodes ago, and was a position previously held by Andrea Leadsom, who had been a contender for the Tory leadership at one time against Theresa May. So we might have a look at some of the health lineup and widen that from just looking at the health secretary going forwards. But the return of an interesting name. So many out there will remember Lord Darzi. I remember him for talk of Darzi centres. Which sounded a lot like sort of clinical diagnostic and treatment centres that we are likely to still be getting in the near future. And I think he also made comments about bringing GPs into the fold of the NHS, so sort of removing that independent provider GP model in the past as well. Unclear whether he still holds those views or not. So he's been made. I think what's the title? Undersecretary. What's the title? I think he's an Undersecretary of State for Health. I think. No, that's Neil Kinnock. No, he's been brought in as a special advisor. Sorry, these things do get complicated. So he's been brought in as a special advisor, and he's going to contribute to and be prominent in a rapid investigation into the state of the NHS, which will be published in September. So look out. I'm sure we'll be covering that when that does come out and is published. And that will feed into a new 10-year plan to radically reform the NHS. So that will be really, really interesting. And they're saying that there'll be some patient and staff consultation as part of that process. Interestingly, another name, so Sally Warren, not a name that I'm familiar with, but she's mentioned in the article, and she's somebody currently working for the King's Fund. And we often cover articles from the King's Fund on the podcast. And I think we have a good amount of respect for the work that they do there as a think tank and research body looking at health policy. So she will be leading the 10-year plan to radically reform the NHS. So that will be interesting. Just a few a few more thoughts about Lord Darzi. So he was a previous parliamentary undersecretary for health. So I think that's Neil Kinnock's role now. That's from 2007 to 2009. He is a surgeon by background, an academic surgeon. So he did work for a long time in medicine and surgery. And it'll be very interesting to see what his contribution is going forwards. So let's just see if there's any more comments, and it's your last chance to make a comment before we wrap up in a moment. Hopefully we're keeping up to date. So Miss Melody is kindly taken up the mantle of providing some comments for me to interact with. So honest feedback. Okay, thank you. Workers are annoyed having to take a whole day off instead of booking a normal appointment slot. It is being discussed on the streets. So I guess that's people annoyed about the system, I think adopted by many GP surgeries, where they will say, oh, okay, we will call you back today to telephone triage your need. Yeah, I think it is annoying actually. And I'm a GP, but I sometimes need to speak to my GP to access healthcare, and it's really difficult because we have a job to do. It's difficult waiting for a call from my GP while I'm calling people as their GP. It's very very sort of meta. So thanks for that feedback, and I agree with you, JC. It's whatever happened to appointment slots? Why did they disappear? I think some practices are still offering advanced appointment slots, but I think there's been a big push for access from the government, and that's led to many practices having to adopt a system where they will get back to people the same day, but because of the level of demand and trying to speak to people according to need, that often means they can't provide guidance on when they will contact you within that day. So thanks for all the feedback there, JC. So last story, and it's really just to say that the BMA ballot on GP industrial action is still ongoing. It is open until the 29th of July. It is open for GP partner members to vote. If you're not a member, you can join and become a member for 3 months free in order to vote. And the vote is about putting in place from what would be the 1st of August, so shortly after the ballot closes, some of the suggested industrial action measures from a menu which is given on their website. We've talked about what's on the menu before and really just wanted to remind people to vote. You may vote for, you may vote against industrial action, but I think it is important, if you have that ability to vote, to exercise that vote. So hopefully people didn't mind listening to me in the absence of Gandhi. I'd like to really thank Gandhi for providing that video to give me something to bounce off of. That was really, really useful. And thank you very much to people who've commented over the course of the day. Just one final comment, just sneaking in before the final whistle, is from Alexandra Fox, who says, hoping the ballot will lead to action and improvement. Yeah, here. I think everybody wants a positive outcome from this difficult situation. So that brings us to the end of the episode today. Gandhi will be back soon and we'll be going live together in the near future. But for the moment, thank you very much for joining me, and hopefully we have managed to enhance your primary care and learning. Thank you.